All right, so welcome. We're going to let people get settled in here, and then we'll begin in a few minutes or a minute. All right, so I'm Jessie Burke, Associate Dean for Education and faculty in the Department of Behavioral and Community Health Sciences. And I want to welcome you all to our Pitt Public Health Conversations about COVID-19 seminar series. More information about the series and other Pitt Public Health COVID-19 efforts is available on our webpage, where you will also find recordings of prior conversations and also responses to some of the questions that were asked but not answered during the sessions. So last week, there were a number of great questions that didn't get answered by the speakers during the session, but they have subsequently drafted their responses, and those are now posted on the website. So I encourage you to go there to get additional information. There's also a copy of the Nature article that they discussed last week. All right, so following my introductions, the speakers will present, they'll discuss the topic, and then we'll open it up for questions from the audience. When we get to that portion of the Q&A, please use the Q&A function to ask your questions, and I'll help to moderate the discussion. Also, please note that we're recording the seminar. So this is great. We have had fantastic attendance, and I'm really excited about today's session. There's so much uncertainty about the future, and as scientific evidence and understanding about the coronavirus keeps evolving, it's really clear that clear communication is critical. It is also clear that that is incredibly difficult. So it's my pleasure to introduce our speakers who will discuss the spread of COVID-19 misinformation and strategies to help us accelerate the transmission of accurate scientific information related to the pandemic. So Steve Albert is here. He is chair of the Department of Behavioral and Community Health Sciences and is the Hallen Chair of Community Health and Social Justice. His research focuses on public health aging, HIV, neurologic disease, and health behavior. He currently co-directs the Clinical and Population Outcomes Core of the University of Pittsburgh Claude D. Pepper Older Americans Independent Center. He served as co-director and then director of the University of Pittsburgh CDC Prevention Research Center. I'm also really excited to have Beth Hoffman here with us today. She's a PhD student in our Department of Behavioral and Community Health Sciences and a research assistant at the University of Pittsburgh Center for Behavioral Health, Media, and Technology. Beth's research primarily focuses on public health implications of the portrayal of health topics on popular TV programs. She and I talk a lot about TV, and the spread of health information and misinformation on social media. Her research examining the anti-vaccine movement on social media has been featured in multiple news outlets, including CNN, the New York Times, and a recent documentary on the Hulu streaming service. So I'll now turn it over to Beth, who will begin our conversation.
Thank you so much, Dr. Burke. Let me just share my screen here. Okay. Thank you all so much for joining us here today. I'm really excited to talk about this important topic. Misinformation about COVID-19 has been spreading rapidly, especially through social media. And this led the World Health Organization in February to declare an infodemic. When thinking of the cause of this proliferation of misinformation, one thing I'd like to highlight is that this is the first pandemic in the age of ubiquitous social media use. The last WHO declared pandemic was the 2019 H1N1 outbreak, during which only 36% of US adults used at least one social media site. Today, that percentage has doubled to 72%, with Facebook, the most popular platform, reporting 2.4 billion active monthly users. Not only are there many platforms and many users, but these platforms are constantly evolving and new ones are being generated, making it really hard to keep track of all the information being shared on them. Before talking more in depth about COVID-19 related misinformation, I'd like to take a few minutes to talk about science denialism more broadly. The framework I present here was first published in 2009 and outlines 5 characteristics of science denialism. They include conspiracies, fake experts, selectivity, impossible expectations, and misrepresentation or using false analogies. Previous research has focused on these tactics and their use to spread misinformation related to Ebola, the safety of e-cigarettes, and alternative medicine. This misinformation is translated into real-life harms, including hostility toward health professionals working to control the Ebola epidemic. And of course, these tactics have been used to spread misinformation about vaccines, causing decreased vaccination rates and outbreaks of vaccine-preventable diseases such as measles. This is a figure from a publication that my colleagues and I published last year from a study that looked at individuals who expressed anti-vaccine sentiment on Facebook. And here you can see the results of our social network analysis, where we found that individuals who were expressing this sentiment were not just concerned about the MMR vaccine causing autism, that they had a variety of reasons for being against vaccines, and that these reasons broadly clustered into 4 subgroups: trust, promotion of alternative remedies, safety concerns about vaccines, and conspiracies. And when we did the study, we also saw that people who were posting against vaccines were also posting a variety of other health-related content on their Facebook pages that often fell into the naturalness or alternatives or conspiracy categories, such as promoting natural remedies for cancer, raising concerns about water fluoridation, both from the naturalness and conspiracy sides, and conspiracies about technology. So thinking about what I've just discussed and looking more specifically now at COVID-19 misinformation, we're seeing these same tactics being used yet again. This is a graph from a Nature News article that was published yesterday. And you can see here that the authors were looking at the types of misinformation that was prevalent in a number of news articles. And the orange lines refer to misinformation concerning authorities, which fits into both the fake experts and impossible expectations categories of science denialism. For example, we've seen people quoting tweets from the Surgeon General or other scientists from back in January or February, stating that the flu kills more Americans than COVID, and so not to worry about it. As well as earlier recommendations from the CDC not to wear a mask in public as quote unquote proof that scientists are not to be trusted. Another prevalent COVID-19 misinformation category is conspiracy, some related to causes or origins of the virus, some related to spread, and other related to potential treatments or cures. We're also seeing false analogies, such as comparing the death toll from COVID to other causes of mortality, such as car accidents. And we're also seeing non-medical authorities, including our president, touting unproven cures and misrepresenting scientific statements in ways that can lead to harmful consequences, unfortunately, including death. I'd like to take a couple minutes now to talk about one of the most visible examples of COVID-19 misinformation, and that's the pandemic video. For those who have not heard of the video, I'll briefly describe it. It features discredited scientist Judy Mikovits describing COVID-19 as a conspiracy among those trying to profit from vaccines. And in her mind, chief among them is Dr. Anthony Fauci. The video was branded as a documentary, and here you can see it was branded. The video that was just released was branded as a part of this larger coming documentary, and packaged in such a way that made Mikovits appear as a sympathetic victim. The scientific language used in the film is also very appealing. For example, during the film, Mikovits states that wearing a mask in public can cause one to get sick from your own, quote, reactivated coronavirus expressions. Now, scientists have said that they aren't sure what that phrase means, and I'm not sure either. But I think we can all agree that to somebody who's watching this video and is scared and looking for answers, it sounds pretty credible. And that's actually one of the most surprising and concerning things we saw with this video, is the sheer number of people who were taken in by it, and that many people who were taken in by it are people who don't normally believe or share conspiracies. As you can see from this graph published in the New York Times, in less than 2 weeks after its original posting, the pandemic video was liked, shared, or commented on Facebook over 2.5 million times. By comparison, the yellow line is the Pentagon's aerial phenomena event, and in green we see the office reunion, which are also things that have been described as going viral recently. However, they had considerable less reach than this video. So my guess is that many people watching this are probably thinking, okay, I've seen this misinformation, I'm continuing to see it, so what do we do about it? And so one of the things I'd like to say is that as medical professionals are treating patients, and lab-based researchers are working overtime to develop safe and effective vaccines and treatments for COVID-19, it's vital for other public health professionals to support these efforts by identifying individuals and groups vulnerable to misinformation and developing targeted interventions to address their specific concerns. And so now I'm going to take a couple minutes to walk you through a framework that my coworkers, Dr. Jamie Sidani and Karhai Chu, and I developed, which is the ABCs for how we can respond. So the A in our ABC is to be active on social media and to use social media to deliver clear, concise recommendations based on the CDC's Crisis and Emergency Risk Communications Manual. For those watching this who are students at Pitt Public Health, I highly recommend taking Dr. Elizabeth Felter's risk communication class in the fall to learn these skills. And others, you can go on the CDC website, and there are very clear recommendations there, including conveying empathy and sticking to facts that are known, and also just trying to get out there and they say be right and be first. The B in our ABCs is to borrow from influencers. So as the spread of the pandemic movie shows, it only takes a few posts from social media influencers for information to spread. And public health is at a considerable disadvantage in competing for attention and reach on social media. For example, Dr. Jerome Adams, the US Surgeon General, has just over 725,000 followers on Twitter. And that may seem like a lot, but the actor Tom Hanks has over 16.5 million. So you can see here that recently there's been an initiative called the Pass the Mic campaign, in which celebrities are turning over their social media accounts to public health and medical experts. And this started last Thursday with Dr. Anthony Fauci taking over Julia Roberts' accounts for a day. Unfortunately, it's still too early in the campaign to have really good metrics on its influence, but I'm hopeful that this will be a great way to share scientific information with millions of people. And finally, we need to counteract misinformation. A great example of this can be seen here. with Dr. Kathleen Montgomery's story. And Dr. Montgomery is a physician who wrote a Facebook post about the pandemic movie, and it was shared thousands of times. It then came under attack by supporters of the movie, but members of the organization Shots Heard, which is a pro-science rapid response network, helped her block those people and keep her pro-science post circulating. I spoke to her after this happened and got her permission to share her story. And she said, quote, "It was so relieving to know that there's a group out there whose purpose is to combat disinformation and protect physicians who are trying to do the same." And so I think if we can remember that we're not alone out there counteracting this misinformation, I think that can be really helpful to remember when the misinformation just seems overwhelming. And so with that, I'd like to thank you again for being here today. I'm sorry if I have headphones in, but in the background, my kitten has started playing with a loud toy. So sorry if that, if you can hear that. And with that, I turn it over to Dr. Albert.
Okay, let me share my screen. Thank you, everybody. Thank you, Beth, for setting up the discussion so well. And thank you, Dr. Burke, for the introduction, and to our tech team for excellent supports. Let me go to the beginning. So I'd like to just echo a few things Beth said right away. And that is that mis or disinformation is not benign. We know that already. And here's a survey from the UK that just came out a couple of days ago that, you know, ordinary prejudices and hatreds have been linked to vaccine denial and now COVID conspiracy theories. And maybe it's not so surprising, but Muslims and Jews here are more likely to be blamed for creating this virus. And even things which strike us as strange confabulation, like Prime Minister Boris Johnson faking having coronavirus, now have advocates on the web. So this is the situation we live with today. I also just read the news today that the hydroxychloroquine study in the Lancet, which did not show benefit, and which, by the way, is probably a flawed study for many reasons we can go into later, that author required police protection because people were unhappy with the finding, at least to something I saw in Nature today in one of their blogs. So we are in a polarized kind of world. I don't think that's news to anybody. And vaccine denial, COVID conspiracy theories join together because who prepares vaccines and who distributes them? Well, it's pharmaceutical companies and it's usually governments. And so it already is hooked on to deeper sentiment that is very uncomfortable with the idea of authority, where there's a climate of not very much trust. And that toxic brew, I think, is what we're seeing. It's not surprising that many of the dynamics of these sorts of beliefs hook into what we see with hatred networks, recruitment networks to the far right or the far left. And I think that is the world we live in. And the question is, what can we do about it? The internet allows proliferation of this sort of thing, but is also a wonderful laboratory for understanding the dynamics of the spread of this kind of thinking. So I want to draw your attention to some of those kinds of things. Already we know from prior studies that disinformation or misinformation spreads faster than the truth. There's something about the novelty and shock value of falsehood that makes it circulate faster. You might have seen when you go onto the internet very enticing ads, which are sometimes called clickbait. It's that kind of thing where something is so outlandish that or speaks to some kind of suspicion somebody may have that people want to know a little more about this and are brought into these kinds of networks. So what do we know? The Infodemic Observatory is an excellent website and has been coding and scoring COVID information, and finds that something like 30% of all the posts on the major social media sites are false information. And they also claim that about 40% of these messages seem to originate with bots, although the definition of a bot is complicated, and what we mean by a bot is something we can discuss in a little bit. The problem is the internet allows a very efficient spread of this kind of thing, and we now have studies that have let us see a little bit better how it works. This picture comes from Huntington Beach. It was published in the New York Times. These are people against the physical distancing, who want to open up the economy. And if you can read his sign, it says, "We are on to this pandemic. Open California now." Certainly there is an audience for this kind of thing. And I think at least on the internet, and at least for our purposes, I think we should contrast scientific reasoning with what I call partisan motivated reasoning. Here's an illustration that came from a PNAS paper published last year before the COVID pandemic. The National Academy of Sciences and Medicine did a very careful study of the economic and fiscal consequences of immigration, published in 2017. You can read some of the findings from that report in quotations on the left-hand side of the screen. On the right-hand side, you can see what partisans did to this report. This includes Breitbart News, the Heritage Foundation, and our own president's 2017 State of the Union address, completely inverting the major findings of that study. So I think we're never going to be able to completely short circuit this kind of thing, but we need to understand it better for some of the reasons Beth mentioned, and to see how it changes the discourse for something like responses to COVID. So let me go into one study that has just come out in the last week or two. It was a study between pro and anti-vaccination views on a number of social media platforms. Here are some of the results that were highlighted in a New York Times article, just to show you that they actually did read it correctly, did interview the author properly, did present a fair view of that study. And you can see already that, some of the key findings. Let me walk you through them. I think the takeaway from this right away is that it's not just people who misunderstand or don't understand or don't have the background to appreciate the science. If it were that, it would be much easier, I think, to educate people and get the right messages out. There is a motivated partisan reasoning going on as well, where certain websites seek to convert and bring other websites or networks into their own frame. And you can see on, I think Beth mentioned this as well, that there are attempts to attract other websites like the ones that a liberal yoga mom might go to, or a libertarian, and speak of your right to choose your own medicine, or that sort of thing, and hook onto these. So let me just go into it a little bit. It's a kind of a worth looking at. It's a very sophisticated network analysis. I'll just give you some of the highlights. Basically, they took a troll of 100 million of the 3 billion Facebook users that had the word vaccination or vaccine on their page, and scored these pages. So they could be pro or anti-vaccination or undecided. The undecideds were identified as people who had looked into or the anti-vaccination or pro-vaccination site. The blues are pro-vaccination sites. They would be things like the Gates Foundation. The reds would be anti-vaccination sites. They might be like the sorts of things Beth was talking about. And the greens are undecided, which range everything from a local PTA in a school to any kind of organization that has to do with adolescence or child health or anything of that sort. And right away, I think if you look at this figure, you can see that the red dots, the anti-vaccination pages, are more central among those green uncommitted or undecided pages. They're just more closely linked. It's a very interesting story why that is, because if you look toward the bottom, you can see that in fact the anti-vaccination clusters, there are more of them, but they actually represent fewer individuals, and that's worth thinking about as well. So let me just walk you through. They talk about 7 different reasons why you might see these sorts of dynamics. So first, the anti-vaccination clusters are more central. That is, they are heavily entangled with these undecided clusters. That's only a way of saying that there's more interaction between the anti-vaccination clusters and these undecided clusters. A very interesting finding from this research was that the undecided pages are very active. They actually are seeking to be connected, and they are more likely to connect with the anti-vaccination clusters than with the pro-vaccination clusters. I should have said that they identify these clusters and follow them over a time period. So the anti-vaccination individual pages form many more clusters. They're more decentralized, which allows them to appeal to different uncommitted clusters. Kind of interesting that this less centralization allows for greater interaction and outreach with the undecided clusters. And there's a larger number of sites for engagement than the pro-vaccine pages. Another way to look at this is that the anti-vaccination clusters are more central. That is, they're more related in different ways to these undecided folks. And they were able to track the conversion of these undecided clusters into anti-vaccination clusters. And that's what's shown in this. This is the increase in centrality. I think earlier you can see the increase in cluster sizes. So they are bringing some of these undecided folks into their sphere. And that would be when the uncommitted person recommends the anti-vaccination site to somebody else. So they also were able to look a little more carefully at what these anti-vaccination sites offer. And this confirms what Beth already mentioned. They blend topics that are of interest to people outside of anti-vaccination thinking, but which can help recruit them to that anti-vaccination mentality. So they might speak about the safety concerns about vaccine, or more general conspiracy theories, or maybe alternative health and medicine. And now, of course, raising doubts as well about the causes and cure of a COVID-19 virus. Many of them hook onto this pandemic and that kind of thinking. And so they are the ones that grow, these anti-vaccination clusters are the ones that grew the most during the measles outbreak in 2019, and the pro-vaccination clusters did not grow very much at all. Some of these anti-vaccination clusters grew threefold. So they're interacting with a susceptible population and slowly, you might say, infecting them or converting them to anti-vaccination sentiment. And I suspect if we redid this analysis in the COVID age, we would find something very similar going on, perhaps with the same sites. Just to echo what we've already heard. These medium-sized anti-vaccination clusters grow the most, and also they have a favorable geography. You know, you think about an anti-vaccination site reaching out to you, and they are able to say, oh, well, we have connections to European sites. We're part of a worldwide movement, and that may also influence their ability to bring others into their networks. So those are the kinds of network dynamics we see. It's this strange mix of the organic activity of the internet with a partisan motivated reasoning trying to recruit people to these anti-vaccination networks. And I think this is revealing for us. It really points to what I like to call the Frankenstein nature of social media. They are not under anyone's real control. There is an organic growth kind of component to these things. They offer wonderful benefits in that I think the COVID pandemic is probably the best tracked epidemic we've ever had. We get data in a fire hose every day, but also by the same token, it allows this sort of conspiracy thinking and misinformation to proliferate. So the same authors recommend that we, on the pro-vaccination, pro-science side, use the internet and internet dynamics or social media dynamics to try to turn these things in the favor of the pro-vaccination community, the public health community. And taking a lesson from the anti-vaccination crowd, it would be very good to increase the heterogeneity of pro-vaccination sites. It's not good having a blue chip site like the Gates Foundation as one of our only sources. We need to have much more homespun pro-vaccination sites that might stress different components of the advantages of pro-vaccination and connect in different ways to that kind of thinking. And they've done in this article some modeling of if you could change some of these features, what might happen? How could you stem the growth of the anti-vaccination clusters? So I recommend the article. They are very strong in thinking that the internet is not so different than any kind of political campaign when it comes to recruiting people to your networks. I myself am involved with a very interesting little experiment with my own family, where we have some anti-vaccine thinkers, and also some people who are, I would say, fall into the conspiracy kind of thinking. And I'm very curious, if you present a compelling graphic like this, which compares two countries, can the data help bring someone around? Are these kinds of figures compelling to doubters? And if not, why not? What can we do to make these kinds of figures more compelling? So this is the comparison of Sweden and Israel. Sweden, as you know, put in a mild form of social distancing. Israel, a much more drastic form of social distancing. And this data comes from Our World in Data, one of the COVID tracking sites, this one from Oxford. And, you know, it's undeniable that the imposition of severe social distancing changed the attack rate and infection curve. And in Sweden, for example, we see nothing like this kind of reduction in cases. I'm not saying that the Swedish approach in the long run will be so different. We have to see how this plays out. But there's lots of evidence to suggest that the Swedish approach results in a very high death rate, a very high case rate, and perhaps not as much economic benefit as one would expect. But my bigger concern was, is a figure like this compelling? And if not, why not? What can we do to make our data speak more clearly? And just to conclude a little bit, I think if you accept my approach that what we're dealing with is partisan motivated reasoning hooked onto anti-pharmaceutical, anti-government thinking in a climate of lack of trust more generally, what can we do? I think it's very easy for people to be bamboozled in this setting. Now, bamboozled is one of these great verbs, which I think we should use more regularly. It's easy to be bamboozled. There are many sophisticated sources of mis and disinformation. Beth mentioned a few of them. They know how to use platforms very well to spread. There's less regulation of news on social media and less trust of mainstream media. And in our current climate, unfortunately, there's greater doubts about objectivity, more partisanship, and more fear. Network science helps us identify, I think, points of leverage for elevating science over this partisan motivated reasoning in the competition for attention. But maybe we have to play that game better. And how to do that, I think, is something public health needs to consider more. And finally, I think just for us all, one of my favorite quotations is from the physicist Richard Feynman in his wonderful book, Surely You're Joking, Mr. Feynman. And he says, take care not to fool yourself. The first principle is that you must not fool yourself, and you are the easiest person to fool. And I think that is really good advice for us all. And how to do it is more challenging than we think. So I thank you all. Please, we're interested to hear your thoughts and questions. And let me stop sharing my screen.
Steve, I was wondering if, since you showed those great graphs from that Nature article, and we're seeing how this information really is traveling quickly over social media. What role do you think the social media companies should play in flagging misinformation or taking down misinformation?
Well, that's very topical, isn't it, today?
Yeah.
For those of you who haven't had your daily dose of news, you may know that Twitter is beginning to label falsehood information that has a health impact and is potentially dangerous with a flag and a referral to more accurate sources of information. And they applied that to a number of tweets from our president. So this is all in the news, and our president has responded by threatening retaliation, and I think has already pushed that case. It's not unclear of its legal status. My own feeling is that Twitter is doing exactly the right thing, and Facebook should be doing the same. I think it's very difficult to decide what's truth, and we don't want to stifle free thinking. It could easily be turned against people who we like, who are speaking the truth in certain settings. But to have this kind of fact-checking when there's a public health implication for false information seems to me to be reasonable, much like putting a warning on a pack of cigarettes and a graphic image. And I think that is a reasonable approach. I don't think it's possible in any case to tamp down the conspiracy thinking. I think we need to do a better job of educating people, and referring people to better sources of information is certainly a reasonable way to go.
So I'm going to jump in here because I had a follow-up question, and then encourage our audience members to post their questions in the Q&A. So a follow-up question is, the evidence keeps changing really quickly, right? And this is certainly leading to mistrust and confusion. That is true in my own family as well, right? That sort of, well, what do we know is truth or misinformation, and how do we handle that? And so I guess this idea of how do we navigate the changing recommendations and to facilitate the trust development with the general public? And Beth, do you want to start with that?
Sure. Yeah, as I mentioned, one of the things we are seeing is people quoting previous posts from the Surgeon General, from noted virologists and other public health experts. Nobody has done it to me yet, but even I tweeted back in February or January something along the lines of, make sure to get your flu shot. Worried about influenza than COVID. And I think, and people are saying, well, look, we can't trust, people. They weren't on top of this back then. And I think what's tricky about that is scientists, we're trained as scientists to manage uncertainty and to know that the evidence changes. We look back at how, 200 years ago, we had the miasma theory as opposed to germ theory, and we see that as how science grows. And so I think what we need to do is be communicating that to the public, that, we're seeing those same kinds of shifts that we've seen in the past, except rapidly and in real time and playing out on social media. And so I think the more we can be communicating about how there's sort of this false dichotomy of right or wrong, and just saying, we're doing the best we can. And again, showing that empathy of, I know this is confusing and I know this is scary. And I know a month ago we said, don't wear masks, but this is what the science shows now. It's my hope that, that will go a long way.
Good answer. I'll just chime in a little bit. When I was a young parent, we were told to put our infants on their stomachs in the crib. Now the recommendation is no, put them on their backs. I think the truth of the matter is science is this evolving kind of thing, but I don't want to let the CDC off the hook. They are supposed to be the arbiter of the state of the art for what science tells us. And if they are inconsistent and shift, and if they are not allowed to let the data speak the way it should, I think we compound an already difficult problem and maybe make it much worse than it needs to be.
So the questions are now coming in quite quickly, and I'm going to try and do my best to moderate. So back to something, Beth, that you shared earlier about partnering with celebrities or influencers. I think there's a two-part question. So one is, and it just moved on my screen, sorry about that. So the idea, is there any concern about partnering with them and the legitimacy of listening to their opinions or assessments on public health or other matters outside of their expertise? So, I don't know, we want to harness the expertise of the public health professionals, and how does that happen in collaboration with celebrities? I guess we'll start there.
Sure, yeah. So one of the things I've been thinking of is with that Pass the Mic campaign, for example, the advertisements for it specifically had the celebrity saying, I'm not the expert, you shouldn't listen to me, but you should listen to Dr. Fauci. And I also think of the commercial from a few years ago, going back to some of my work on TV dramas, where we saw people who played medical professionals on TV, like Neil Patrick Harris or Alan Alda, Patrick Dempsey, saying, I have no idea what I'm doing, but you should go see your primary care physician who does. And so I think partnerships like that are ways that we can harness their reach and our scientific expertise.
Good.
That's great, thank you. So Steve, I have a question here that follows up on your point about whether images are compelling, data, how it's presented. And this participant is a former high school biology teacher who suspects that the answer is they're likely not because of deficits in science, basic science literacy skills, like understanding graphs. And are you aware of work being done at the intersection of public health and K through 12 education to address these fundamental science literacy skills?
Well, this is an excellent question, and you may be right. And you know, we need to have the science literacy. I was hoping a graph like that is more or less obvious to people who are, you know, but maybe I'm overly optimistic and naive. But in any case, we should be working more in the schools, and public health is not a curriculum people get in high school. And I think our Midas lab, which is involved in infectious disease modeling, at one time was developing a curriculum for high school. And maybe if we had something like that in place as part of our more general public health preparedness, it would make a big difference.
That's great. Beth, do you have anything to add?
No, just that it's something I definitely agree with. You know, we need a real concerted effort with media literacy and health literacy. And, you know, I think what we're going through right now is going to change a lot of things in our society. And it's my hope that one of the things will be more investments in that. So.
And there's a follow-up post here about media literacy, health literacy, science literacy in our educational systems, and advocacy efforts. So I'll just put a plug in there too, sort of the opportunities that we have to begin that at an early age is an opportunity. Okay, so I have a couple other questions here. So given the public attacks on traditional media, is there any benefit to trying to link true scientific discussions with traditional network media, perhaps similar to Tony Fauci's partnering with celebrities? Beth, do you want to answer that one?
Sure. I mean, I think absolutely. There's an organization I work with out of USC called Hollywood Health and Societies that I know has been trying to partner with celebrities from all, you know, sort of that would appeal to different age ranges and different demographic segments of the population to generate sort of PSA or commercial type media for dissemination. I think also this is a great question, Steve. I'd be curious your input, just given that we know that you have a lot of expertise with older adults, and we know that older adults tend to be one of the highest consumers of news media. So I'm not sure if you've thought at all about how we can reach that segment of the population, especially.
That's a good question, Beth. I don't know too much about the TV habits, but I know the Fox News audience skews old, so you're right about that. And one thing that I have not seen too much of is how much of the influence comes from cable news versus social media, and perhaps it affects different segments of the population where age is certainly an important criterion there. So I don't know, but I would say, yeah, why not find sympathetic celebrities to work with us? Some of them are even trained in science.
Yeah, I will say I saw a study that was published a couple years ago where they had people who were hesitant about vaccination watch a clip from the Daily Show, so using humor to discuss the measles outbreak in California at the time, versus a clip that they edited to not be humorous. And they found that people who watched the humorous video were more likely to then support vaccination afterwards. And so that's a study that I would love to personally be replicating with a lot of the late night comedy we're now seeing, you know, streaming on platforms like YouTube and stuff. So I think there's a lot of content out there. It's just figuring out how we can best use it.
So I'll ask a follow-up question, very specific to Pittsburgh and the region, right? This idea of using celebrities or influencers and spokespeople and partnerships with public health researchers and scientists. How can we apply some of this within our region locally to address COVID-19? Are there people that the general public might trust more so, or ways to sort of drill down to the local level here?
So the first thing that comes to mind here in Pittsburgh is sports stars. I know many people, including my nanny who raised me, who is watching Steelers games right now on repeat, and the lack of other professional sports. So I'd say partnering with sports stars. I think, you know, even former Steelers players like Franco Harris, someone like James Conner, who has a history as a cancer survivor, would also be a great way to talk about vulnerable populations and immunocompromised populations. I saw Sidney Crosby donate 100,000 meals to the Pittsburgh Food Bank. So he also comes to mind, as does Mario Lemieux with all his charity efforts. And then two more ideas on this. One is that I read something recently about this idea that we're all a sports team together and we need a good coach. And so perhaps dipping into again, with the sports coaches here. And then finally, I think as much as we can, invoking just the legacy of Mr. Rogers, this idea that, you know, we're here to care for our neighbors, and sort of what would Mr. Rogers say. Steve, I don't know if you have it. Sorry, I kind of took that one and ran with it.
I thought of the same two things, actually. You know, all the sports teams have special games for breast cancer awareness and fundraising. You know, we need to act more quickly to respond to our current pandemic, and the sports would have a great influence on people, I think.
So that leads me really nicely to follow up, Steve, for you, or both of you. Sort of, how do we prepare people for what's next and the second wave of the pandemic this fall? It feels like we do have a moment in time right now where that feels really critical. And I'm wondering if you can comment on that with regard to sort of communicating key messages and combating some of the misinformation so that we are better prepared and ready in the fall.
Wow, that's a great question. Beth, can you answer first so I can think?
Sure, I'll try. You know, I think one of the things is I think just this idea of also being transparent. And again, I'm going to come back to empathy, you know, emphasizing that, you know, we don't know, and we don't want to make promises, you know, saying that, well, this is when things will return to normal, or what even the new normal will be. But again, that idea that, you know, we're all in this together, and that, you know, as best as we can follow recommendations right now, that will hopefully help keep things from getting worse. I also think this is a really opportune time, in that this is the first time I'm aware of since the anti-vaccine movement really took off, that we're seeing organized anti-vaccine opposition to a vaccine that doesn't exist yet. And so I think thinking about how can we as public health professionals also be working to kind of get ahead of that curve. Just last month, the anti-vaccine sort of bigwigs, if you will, they organized the Health Freedom Summit, where they were training their members in advocacy and organization. I have yet to really see that on the public health side. So I think we just need to, you know, be thinking ahead and really thinking of strategies. What are people's concerns? How can we develop tailored messaging? How can we develop campaigns leveraging, you know, whether it's sports stars or celebrities, you know, getting their vaccine? and things like that.
Let me throw in another thing too. You know, if we had a clear plan with benchmarks from CDC implemented through our state health departments down to the level of, you know, clear benchmarks for testing, tracing, isolating, monitoring cases, monitoring deaths, monitoring response to therapy, I think a lot of this would work itself out fairly well. We don't have that kind of direction and plan. We don't have clear benchmarks. The ones that have come out of CDC or some governor's offices are excellent, but we're not implementing them systematically, and they're being thrown to the winds in other places. So people don't have a clear plan going forward. And I think that's probably the real place where we need to work. And it's not something completely within our control. This is unfortunately a political and a leadership question. And that, I think, is one of the reasons why the conspiracy movements have taken off so well. That absence of leadership and direction.
Which feels somewhat overwhelming, but on the other hand, you know, I do think that we have some tools that we can use, and maybe as public health professionals, some of us need to get a little bit outside of our comfort zone. We're very good at doing good science and research, and maybe don't always have as much training in communicating on social media in just a few characters, and sort of sharing messages. But I would hope and encourage us all to think about how we can get more engaged in those platforms. And Beth started us off by really that piece of encouragement for us all that we can do a little bit more in that space to help combat some of this misinformation. I'm aware of time. I wanted to give you each a second to have any closing comments or thoughts before we wrap up. I'll start maybe with you, Beth, if you just if you have anything, any parting comments for us.
Sure. I feel like sometimes when I both talk about this topic and also am combing through the social media data myself, it's easy to feel a little disheartened. But I think there's lots of reasons to be hopeful. I think we've seen things coming out of this pandemic, such as you know, better uses of technology, increased awareness to what public health even does and is, that I think are real positives. And so, you know, I've talked a lot today about vaccines, for example, but I just want to encourage everyone who's in public health or whatever you do, you know, your expertise doesn't have to be about COVID specifically. I mean, there's still people out there suffering from strokes. We're still dealing with chronic disease. We're still dealing with other infectious disease. And so, you know, we can all contribute and all be, you know, raising awareness about whatever we're knowledgeable about and passionate about.
Great. And I would only add, you know, none of us is immune from this kind of motivated partisan reasoning. I really do feel the quotation from the physicist Richard Feynman is right. We've got to take care not to fool ourselves. And if more people did that, we have to also help people so that they take care not to fool themselves. And that there hangs a tale. And I think the work that Beth and others are doing and the network scientists are doing will help us figure out the best ways to do this.
Well, I really appreciate you both taking the time to share your thoughts and expertise and to discuss what is an incredibly important topic. I hope that everyone who is a participant will join us again next Friday at 4 o'clock when 2 faculty members from the Department of Biostatistics will discuss statistical considerations in modeling the epidemic progression and the use of COVID-19 related tests for estimation and decision support. So in this seminar series, we really are trying to cover the breadth of public health and what we do at Pitt Public Health, and I'm excited for their conversation next week. I know that there were a number of questions we didn't get to, but as we have done in the past, I promise you that I will ask Beth and Steve to please write up some written responses to those questions, and we will get them posted along with the recording on the Pitt Public Health COVID-19 webpage. So thank you all again. Have a great evening and enjoy the weather. Take care.
Thank you.
Thank you.